Ever feel like you're holding your breath? Not literally, of course,
Right.
but in that, figurative sense, like when you're waiting for some big news or
Yeah.
maybe you see those flashing ambulance lights behind you. It's like this primal thing, right?
Absolutely.
You suddenly realize how much we depend on every single breath.
Yeah. It is fascinating how breathing is something we just do without even thinking.
Yeah.
Yet it's so fundamental to everything.
It really is.
Yeah.
And what's scary is that lung issues are becoming more and more common, whether it's air pollution or new viruses or even just the stress of, modern life. It all takes a toll.
For sure.
So today we're going to really dive deep into these pulmonary conditions, the kind of ailments that can really steal our breath, impact our lives in huge ways.
We've got some really interesting stuff to look at. We've got excerpts from a recent pulmonology presentation that covers a whole bunch of conditions, from the more familiar ones like asthma to the more complex ones like cystic fibrosis and ARDS.
Huge thanks to London Heartbeat's Z Academy for these incredible resources.
Yes.
Seriously, if anyone listening is interested in learning more about health and the body, check out their 150-plus courses. They're on all the socials: Facebook, Instagram, Spotify, YouTube.
Yeah, check them out.
So subscribe and stay tuned because we'll have more discussions like this one coming up.
Absolutely.
So to kick things off with our exploration of these pulmonary conditions,
let's
start with something that most people have heard of: asthma.
Okay.
It's often described as a chronic inflammatory disease of the airways.
Yes.
But what does it actually mean for someone who's experiencing it?
So it's not just about, feeling a little out of breath after you climb the stairs or something.
Right, exactly.
What happens during an asthma attack is, imagine your airways, the tubes that carry air in and out of your lungs, they suddenly go kind of haywire, so they constrict, which makes it really hard to breathe.
Oh, wow.
And then the lining of the airways gets inflamed and swollen. And so that narrows the passage even more.
Gotcha.
And then to make it worse, your body starts producing all this extra mucus, which further blocks things up. So it's like this cascade of events that can make breathing, just normal breathing, a really scary struggle.
That paints a much more vivid picture than just saying inflammation.
Right.
And what kind of things trigger this cascade? I mean, we all know about allergens.
Yeah.
But the presentation mentions some other kind of surprising culprits too, right?
Absolutely. Well, things like pollen and dust mites and pet dander, they're all common triggers.
Yeah.
Some people find that their asthma is actually made worse by things like aspirin or certain food additives or even changes in the weather.
Ah, wow.
And believe it or not, even strong emotions, like if you're really stressed or anxious, that can trigger an attack.
So your airways can literally be constricted by just stress.
Yeah.
That's crazy. It really shows how our physical and emotional states are so connected.
Yeah.
The presentation also mentioned something about carbon dioxide levels during an attack.
Yeah.
That a normal level could actually be a bad sign.
That's right. You'd think low carbon dioxide would be a good thing.
Yeah.
But in this case, it can mean that the person is struggling so hard to breathe that they're not exhaling effectively. And that can lead to a buildup of CO2 in the blood.
Right.
And that can be a sign that the person's heading towards respiratory failure, which is a really serious situation.
So that's a huge red flag. So how do doctors actually diagnose asthma?
Right.
And what are the treatments?
Well, diagnosing asthma involves a bit of detective work. The doctor will ask you about your symptoms, about your family history, potential triggers. They'll also do some lung function tests, like spirometry, to measure how well air is flowing in and out of your lungs.
Okay.
One key test is to give you a bronchodilator.
Right.
Which is a medication that relaxes the airways.
Uh-huh.
And if your lung function improves a lot after taking the bronchodilator, it's a strong sign that you might have asthma.
So you're looking for that telltale reversible airflow obstruction.
Exactly.
What about treatments? I know people often use inhalers, but what are those actually doing?
So there are two main types of medication for asthma.
Okay.
Quick relief medications, like the inhalers you mentioned.
Right.
And then long-term controller medications.
Gotcha.
Quick relief inhalers, they contain bronchodilators, which work really quickly to relax the airway muscles, open up the airways, and provide relief during an attack. Long-term controllers, these are often inhaled corticosteroids.
Okay.
And these are taken regularly to reduce the underlying inflammation and to try and prevent future attacks.
So it's kind of a two-pronged approach.
Yeah.
One for immediate relief and then one for more long-term management.
Exactly.
That makes sense. Now let's switch gears a little bit and talk about another really common lung condition.
Sure.
COPD.
Okay.
Or chronic obstructive pulmonary disease.
COPD is a bit different from asthma because it's a progressive disease. Okay.
Which means it tends to get worse over time.
Right.
And it's characterized by this persistent airflow limitation.
Okay.
Which makes it hard to breathe, especially when you're exerting yourself.
Gotcha.
And sadly, it's a major cause of death worldwide.
Wow.
And it's often linked to long-term exposure to irritants, things like cigarette smoke.
Persistent airflow limitation sounds pretty scary.
Yeah.
It's not just occasional shortness of breath, it's an ongoing struggle to get enough air.
Yeah.
So what are the main things behind COPD? What causes it?
Well, smoking is definitely the main risk factor.
Okay.
Those toxins that you inhale when you smoke, they wreak havoc on your lungs.
Yeah.
They cause inflammation. They damage the air sacs.
Right.
Airways thicken.
Mm-hmm.
It's a slow process, but over time,
Yeah.
it can lead to, real disability and even death.
Wow.
But it's not just smoking.
Right.
Being exposed to other irritants over a long period of time.
Like what?
Things like dust or chemicals.
Or air pollution, that can increase your risk as well.
So it's not just about, kicking the habit. It's about being mindful of the air we breathe.
Yeah.
The presentation also mentioned that there's a genetic component to COPD.
Right.
Can you tell me a little bit more about that?
Yeah, so there is a condition called alpha-1 antitrypsin deficiency,
Okay.
which can really increase your risk of getting COPD even if you've never smoked.
Huh.
Alpha-1 antitrypsin is a protein that protects your lungs from damage.
Okay.
And if you're deficient in this protein,
Yeah.
your lungs are more susceptible to the harmful effects of those irritants.
Interesting.
It's relatively rare,
Okay.
but it does highlight that genetics can play a part.
That is interesting. So even if you have really healthy habits
Yeah.
and you avoid smoking,
Right.
you could still be at risk
Right.
if you've inherited this deficiency.
Exactly.
The presentation also talked about a debate about the relationship between asthma and COPD.
Okay.
Can you shed a little light on that for me?
There's been a lot of discussion about whether asthma and COPD are completely distinct conditions
Right.
or whether there's some overlap,
Uh-huh.
maybe even a continuum between the two.
Gotcha.
Some researchers think there's a strong link.
Yeah.
They point to the fact that some people with asthma eventually develop features of COPD,
Okay.
particularly if their asthma hasn't been well controlled for many years.
Interesting.
Others argue that they are separate,
Yeah.
that they have different mechanisms behind them
Right.
and distinct risk factors.
Okay.
So it's complex,
Yeah.
and we don't have a definite answer yet.
So the relationship is still a little bit of a mystery,
It is.
which means that more research needs to be done.
Yeah, for sure.
Now, what about the different types of COPD?
Okay.
I've heard terms like chronic bronchitis and emphysema.
So those are the two main categories of COPD,
Okay.
and they often occur together.
Uh-huh.
So chronic bronchitis,
Yeah.
that's characterized by a persistent cough that produces phlegm, often for months at a time.
Wow.
And this cough is the result of inflammation
Right.
and too much mucus being produced in the airways.
Gosh.
Now, emphysema
Yeah.
involves damage to the alveoli, the tiny air sacs in your lungs that are responsible for gas exchange.
Okay.
This damage means there's less surface area available for oxygen to get into your bloodstream,
Uh-huh.
so it makes it harder to breathe.
So chronic bronchitis is more about the airway inflammation and mucus,
Yeah.
while emphysema is about damage to the air sacs themselves.
Exactly.
So what's the main symptom that makes people go see a doctor for COPD?
Dyspnea, or shortness of breath.
Okay.
That's the real hallmark symptom of COPD.
Yeah.
It's that feeling of not being able to get enough air, like you're gasping for breath.
Right.
At first, you might only feel this shortness of breath when you're exerting yourself, like climbing stairs or walking fast.
Uh-huh.
But as the disease progresses,
Yeah.
it can become more noticeable, even happening when you're at rest.
Wow, that sounds really scary.
It is.
And how is COPD staged and treated?
Staging COPD involves looking at how severe the airflow limitation is.
Okay.
Doctors use a test called spirometry,
Right.
which measures how much air you can force out in 1 second.
Gotcha.
This measurement, it's called FEV1. It helps to figure out what stage of COPD you have,
Okay.
ranging from mild to very severe.
And how do you treat it?
Unfortunately, there's no cure for COPD,
Right.
But there are treatments that can help manage the symptoms,
Okay.
slow the progression of the disease, and improve your quality of life.
So what are the key strategies?
The most important thing for anyone with COPD, especially if they smoke, is to stop smoking. It's the only proven way to slow down the disease.
Gotcha.
Beyond that, treatment usually involves a combination of medications, pulmonary rehabilitation, and in severe cases, oxygen therapy.
Right.
Medications include bronchodilators,
Right.
which relax the airways and make breathing easier.
Yeah.
And inhaled corticosteroids.
Which reduce inflammation.
Okay.
Pulmonary rehabilitation is a program that combines exercise, education, and breathing techniques to help people with COPD manage their symptoms better.
Right.
And improve their physical functioning.
Makes sense.
And then oxygen therapy.
Yeah.
That's used for people with really severe COPD who have low blood oxygen levels all the time.
So it sounds like you really need a multifaceted approach to address all the different aspects of COPD.
Absolutely.
We've talked about asthma and COPD, which both affect the airways and lung function.
Yeah.
But now let's move on to a different type of problem, pneumonia, which is an infection that attacks the lung tissue itself.
So pneumonia is an inflammatory condition that affects the alveoli, the tiny air sacs in the lungs.
Right.
It's usually caused by an infection. And the usual suspects are bacteria, viruses, and fungi. These pathogens can get into your lungs in different ways. You might inhale infected droplets.
Aspirate food or liquid into your lungs.
Oh, wow.
Or it can even spread from an infection somewhere else in the body through your bloodstream.
So our lungs are constantly under attack from these tiny invaders.
Yeah, they are.
And I imagine there are different types of pneumonia, depending on what's causing it and where the infection is.
Yeah, right.
Is that right?
You're exactly right.
Okay.
Pneumonia can be classified in a few different ways. By what's causing it, the location, and whether it started in the community or in a healthcare setting.
Right.
So, for example, we have lobar pneumonia, which affects a whole lobe of the lung. Then there's bronchial pneumonia, which causes patchy inflammation around the bronchi. And then there's interstitial pneumonia, which affects the tissue between the air sacs. And then we also have community-acquired pneumonia, which is what people get outside of a hospital, and then hospital-acquired pneumonia, which happens to people who have been in hospital, often for other reasons.
It seems like pneumonia can take many forms depending on the situation.
It can.
So what are some of the key symptoms that tell you it might be pneumonia?
The classic symptoms are cough, fever, chills, shortness of breath, and chest pain that's usually made worse when you take a deep breath. The cough might produce phlegm that could be clear, yellow, green, or even bloody.
Wow.
But the symptoms can be different depending on what kind of pneumonia you have and the person's overall health. So, for instance, older adults or people with weakened immune systems, they might have more subtle symptoms like confusion or a low-grade fever, which can make it trickier to diagnose.
So you have to be really vigilant, especially with vulnerable people. And not just dismiss a cough or a fever as something minor.
Exactly.
The presentation also mentioned that breathing really fast can be a warning sign for severe pneumonia.
Absolutely. If someone's breathing rate is over 30 breaths per minute, particularly if they don't have any history of lung problems, that's a sign that the pneumonia might be serious and that they need to see a doctor right away.
So that's a clear sign to get medical help.
It is.
You also mentioned the difference between community-acquired and hospital-acquired pneumonia. Why is that distinction important?
Well, the causes, the severity, and how you treat them can be quite different. Community-acquired pneumonia is usually caused by bacteria, things like Streptococcus pneumonia or Haemophilus influenza. It's usually less severe than hospital-acquired, and it responds well to antibiotics.
And what about hospital-acquired pneumonia? What makes it so different?
Hospital-acquired pneumonia is often caused by more resistant bacteria, like Staphylococcus aureus or Pseudomonas aeruginosa. These bacteria are tougher to treat. You need stronger antibiotics, and you need to take them for longer. Hospital-acquired pneumonia is also more likely to happen in people who are already weak or have compromised immune systems.
Makes sense.
So it's a more serious condition, and it can be life-threatening.
So it's not just where you got the infection.
No.
But also the specific bacteria involved. And the person's overall health.
Exactly.
So pneumonia can range from a relatively mild illness
It can.
to a serious medical emergency.
Yeah.
That's why it's so important to see a doctor.
It is.
If you think you might have pneumonia.
Absolutely.
So you can get the right diagnosis and treatment.
For sure.
We've covered asthma, COPD, and pneumonia.
Yeah.
All fascinating and complex conditions in their own right.
They are.
Next, we're going to explore something a little less familiar.
Okay.
Bronchiectasis, a condition that involves permanent damage and widening of the airways.
Right.
This one's a real head-scratcher for me. So I'm really interested to hear your insights on this one.
I'm happy to explain. So bronchiectasis, it's definitely a mouthful, but understanding what it is can really help us understand a whole range of breathing problems.
Bronchiectasis, it does sound pretty intense. What are we talking about here?
Okay, so imagine your airways, those tubes that carry air in and out of your lungs as like the branches of a tree.
Okay.
But in bronchiectasis, those branches are damaged and distorted, like old gnarled tree limbs.
Right.
Instead of being smooth and uniform, they become widened, weakened, and scarred.
Oh, wow.
So it's harder for air to flow freely.
Makes sense.
And to make matters worse, those damaged airways become like a breeding ground for bacteria.
Ugh, that sounds bad.
It is. It leads to these recurring infections and inflammation.
So it's not just that the airways are stretched out of shape.
Right.
It's the consequences of that damage, like the blockage, the trapped mucus, the constant infections. What causes that kind of damage in the first place?
That's a great question, and it's something that researchers are still trying to figure out completely.
Okay.
In some cases, bronchiectasis is linked to a specific condition, like cystic fibrosis, which we'll talk about later.
Right.
Cystic fibrosis causes this thick, sticky mucus to build up in the airways, which leads to chronic inflammation and damage.
Gotcha.
But for a lot of people, bronchiectasis seems to be caused by repeated or really bad lung infections, particularly those that happen in childhood.
So those childhood bouts of pneumonia or whooping cough, they can have lasting consequences.
They can. Those infections can cause a really intense inflammatory response in the airways, which leads to scarring and that permanent widening.
Wow, so the body's trying to fight off the infection.
Exactly.
But ends up causing damage of the process.
It's like the body's own defense mechanisms backfiring a bit.
Interesting.
And it's not just infections that can cause it.
Right.
Inhaling toxic things like smoke or certain chemicals that can also damage the airways and make you more likely to develop bronchiectasis.
Gotcha.
And in some cases, bronchiectasis is associated with immune system disorders, where your body's own system actually attacks the airways by mistake.
So it's like there are multiple ways to end up with these damaged and distorted airways.
Right.
What are the signs that someone might have bronchiectasis? What should we be looking out for?
A persistent cough, especially one that produces a lot of phlegm, that's a classic sign of bronchiectasis.
Okay.
And this phlegm, it's often thick, discolored, and sometimes even foul-smelling.
Oh, yeah.
Yeah, not pleasant. It's because of the bacteria growing in the airways.
Right.
People with bronchiectasis might also experience shortness of breath, wheezing, chest pain, and just feeling really tired.
Makes sense.
These symptoms can come and go, but they tend to get worse when the infection flares up.
So it's not just a cough, it's a chronic, productive cough.
Exactly.
And often these other respiratory symptoms along with it.
Yeah.
How do you diagnose bronchiectasis, and how do you treat it?
Diagnosing bronchiectasis usually involves a few things.
Right.
Clinical evaluation, imaging studies, and sometimes pulmonary function tests.
Right.
A chest x-ray can sometimes show the widened airways.
Okay.
But a CT scan gives a much clearer picture. It lets doctors see how much damage there is and rule out other possibilities.
Makes sense.
Pulmonary function tests, like spirometry, those help assess how well the lungs are working and how severe the airflow obstruction is.
So it's about putting all the pieces together, the symptoms, the imaging, and the lung function results.
Exactly.
And what can you do once bronchiectasis is diagnosed?
Unfortunately, there's no cure for bronchiectasis. But there are different treatments to help manage the symptoms, prevent infections, and slow down the progression of the disease.
Gotcha. So what are some of those treatments?
One important focus is on clearing the airways of that thick, sticky mucus.
Right. That makes sense.
Chest physiotherapy can help with that. It involves techniques like postural drainage and percussion. Those can help loosen the mucus and make it easier to cough up.
Interesting.
There are also devices that vibrate the chest, which helps to break up the mucus. And inhaled medications, like saline solutions or mucolytics, those can thin the mucus and make it easier to clear.
So it's all about getting that gunk out of there.
Pretty much.
What about those recurrent infections that are so common with bronchiectasis?
Right.
How do you manage those?
Preventing and treating those infections is really important.
Okay.
Doctors will often prescribe antibiotics,
Okay.
either orally or inhaled,
Well,
to fight the bacteria in the airways.
makes sense.
In some cases, they'll use long-term, low-dose antibiotics
Okay.
to try to prevent those infections from coming back.
Right.
And vaccinations are also really important,
Yeah.
especially against the flu and pneumonia.
To boost the body's defenses.
Exactly.
Are there any other treatments for bronchiectasis?
Yeah, in some cases, doctors might recommend bronchodilators. Those are the medications that relax the airways and make it easier to breathe.
Right. We talked about those earlier.
Exactly. Those can be helpful for people who also have asthma or COPD-like symptoms,
Yeah, that makes sense.
along with their bronchiectasis.
So what about surgery?
Surgery is a possibility,
Okay.
but it's not common. In rare cases, they might do surgery to remove really damaged portions of the lung,
Right.
but that's usually a last resort.
Okay, so a combination of airway clearance techniques, infection control, and sometimes medication to help with airflow.
Yeah.
It sounds like a lot to manage,
It can be.
but these strategies can really help people with bronchiectasis.
Absolutely.
Now, let's talk about another condition that can have a big impact on the lungs. Cystic fibrosis.
Okay.
It's a genetic disorder, right?
That's right. Cystic fibrosis, or CF, is a genetic disorder that affects multiple organs,
Okay.
but especially the lungs, the pancreas, and the digestive system. It's caused by a mutation in a gene called CFTR,
CFTR.
which stands for Cystic Fibrosis Transmembrane Conductance Regulator.
Catchy. So one little flaw in this gene can have these huge effects throughout the body.
Yeah.
What specifically happens in the lungs when this CFTR protein isn't working properly?
So when the CFTR protein isn't working right, the lungs produce this thick, sticky mucus that clogs up the airways.
Okay, we've heard about this thick mucus before.
Yeah, it comes up a lot.
What makes this different in CF?
Well, this mucus in CF, it not only makes it hard to breathe,
Right.
but it also creates a perfect environment for bacteria to grow.
No.
And that leads to chronic infections and inflammation.
Ugh.
Over time, these infections and the inflammation damage the airways.
Yeah.
And that leads to progressive lung damage. Your lungs don't work as well.
Right.
And eventually it can lead to respiratory failure.
So it's a pretty vicious cycle.
It is.
And you mentioned that CF also affects the pancreas and the digestive system.
Right.
What's happening in those organs?
In the pancreas, this thick mucus blocks the ducts that carry digestive enzymes to the small intestine.
Oh, wow.
Those enzymes are essential for breaking down food and absorbing nutrients.
Okay.
So when those ducts get blocked,
Yeah.
you end up with pancreatic insufficiency,
Yeah.
meaning your body can't properly digest food and absorb nutrients.
That sounds really serious.
It is. It can lead to malnutrition, problems with growth, and other health issues.
Makes sense.
And in the digestive system in general,
Yeah.
CF can cause all sorts of problems like constipation, blockages in the intestines,
Wow.
and even liver disease.
Wow. So this one faulty gene
Yeah,
can really mess up a lot of different systems in the body.
it can.
That's a lot for people with CF to deal with.
It is.
So how do you diagnose CF
Oh.
and what are the treatments like?
They usually diagnose CF using a sweat chloride test,
Okay.
which measures how much salt is in your sweat.
Huh. Interesting.
People with CF have way more salt in their sweat
Right.
than normal because of the CFTR protein not working right.
Okay.
They also use genetic testing to
Okay.
confirm the diagnosis and
Right.
to figure out exactly which CFTR mutations the person has.
So what about treatment?
Treatment for CF has come a long way in recent years.
That's good to hear.
The focus is on managing symptoms, trying to prevent infections,
Yeah.
and improving quality of life.
So what are some of the key things they do to manage CF?
Airway clearance techniques, those are essential.
Right, like we talked about with bronchiectasis.
Exactly.
So getting that thick mucus out of the lungs.
Yeah.
They use things like chest physiotherapy, vests that vibrate the chest, and inhaled medications.
Right. All of those can help.
And antibiotics too, right?
Yes. Antibiotics are really important for preventing and treating lung infections,
Okay,
which are a constant worry for people with CF.
gotcha.
They also often prescribe pancreatic enzyme replacement therapy
Uh-huh.
to help with digestion and absorption of nutrients.
So it's this multi-pronged approach.
Yeah,
Tackling both the lung problems and the digestive problems.
exactly.
I've heard that there have been some pretty exciting developments in CF treatment recently.
There have. One of the most groundbreaking things has been the development of CFTR modulator therapies.
Okay, what are those?
These are medications that actually target the underlying cause of CF.
Wow.
They work by trying to correct the function of that faulty CFTR protein.
So instead of just treating the symptoms,
Right.
they're going after the root of the problem.
Exactly.
That's amazing.
Yeah.
What kind of impact have these CFTR modulator therapies had?
They've been incredibly promising. They've shown that they can improve lung function,
Okay.
reduce the frequency of those flare-ups, and even increase life expectancy for many people with CF.
That's fantastic news. It gives so much hope to people with CF and their families.
Yeah.
We've covered a lot in this segment, from bronchiectasis to cystic fibrosis,
We have.
both conditions that involve chronic lung infections and damage to the airways. Now let's shift gears a bit and focus on another area of pulmonary health, the pleura. Those are the membranes that surround the lungs and line the chest cavity.
Yeah.
So tell me about pleural disorders. What kind of challenges do they present?
The pleura, they're often overlooked, but they're really important for healthy lungs.
Okay.
When something goes wrong in the pleural space,
Yeah.
it can cause all sorts of problems, from fluid buildup to a collapsed lung.
Wow.
One of the most common pleural disorders is something called pleural effusion,
Okay.
which basically means there's too much fluid in the pleural space.
So instead of that space being filled with air, it's filled with fluid.
Exactly.
Why does that happen? Is it always because of a lung problem?
Not necessarily. And that's what makes diagnosing pleural effusions so tricky.
Okay.
There are two main types,
Okay.
transudates and exudates.
Transudates and exudates.
Transudates, they're caused by problems elsewhere in the body.
Like what?
Things like heart failure,
Okay.
liver cirrhosis, or kidney problems.
Uh-huh.
Basically, the fluid leaks out of the blood vessels because of pressure imbalances or protein levels in the blood being off.
So it's a systemic issue pushing the fluid out.
Exactly.
What about exudates?
Exudates are caused by things happening locally in the pleura itself.
Like what kind of things?
Infections,
Right.
inflammation,
Right.
or even tumors.
So you have to figure out if it's a problem pushing fluid out or a problem pulling fluid in.
Exactly.
How do doctors tell the difference between these two types of pleural effusions?
Well, it's a bit of detective work.
Okay.
They'll look at what's going on clinically,
Uh-huh.
and they'll do some lab tests to see if the effusion is a transudate or an exudate.
Okay.
They examine the fluid itself.
Right.
They look at the protein content, the cell counts, and other characteristics.
Gotcha.
And they'll compare certain values in the pleural fluid to those in the blood
Okay.
to see if there are any clues that point to a systemic or a local cause.
So it's like they're analyzing the clues
Yes.
to figure out where the fluid is coming from.
Exactly.
And once they know if it's a transudate or an exudate,
Right.
does that tell them what the underlying cause is?
It helps narrow down the possibilities a lot.
Okay.
So if it's a transudate,
Yeah.
they'll focus on checking for those systemic causes we talked about, like heart failure or liver disease.
Makes sense.
But if it's an exudate,
Yeah.
they have to look deeper into the potential local causes,
Right.
which could be anything from pneumonia to cancer.
So the process of elimination,
It is
using all the clues to find the culprit.
exactly.
It sounds like a real medical mystery. The presentation mentioned a few specific types of pleural effusions,
Right.
like those caused by heart failure, cancer, and pulmonary embolism.
Okay.
What makes each of those unique, and what are the challenges in diagnosing and treating them?
So each type of pleural effusion has its own characteristics and its own challenges.
Gotcha.
For example, with heart failure, you often see bilateral effusions. What does that mean? That means there's fluid buildup on both sides of the chest.
Okay.
Those effusions are usually relatively small,
Right.
and they tend to respond well to heart failure treatment.
What about malignant effusions?
Malignant effusions, those are often unilateral, meaning they only affect one side of the chest.
Okay.
And they can get pretty big,
Wow.
causing a lot of discomfort and making it hard to breathe.
Right.
To diagnose a malignant effusion, they often have to do a biopsy of the pleura to see if there are cancer cells.
So malignant effusions are a warning sign
They can be.
that something more serious is going on.
Right.
What about pulmonary embolism? How does that cause a pleural effusion?
So a pulmonary embolism, or PE, is a blood clot that travels from somewhere else in the body,
Okay.
usually the legs,
Uh-huh.
and it gets stuck in the lungs.
Gotcha.
This blockage can stop blood flow to a part of the lung,
Right.
leading to inflammation and fluid building up in the pleural space. Okay.
Pleural effusions caused by a pulmonary embolism.
Yeah.
they often come with other symptoms as well.
Like what?
Things like chest pain, shortness of breath, and a rapid heart rate.
So the context is really important.
It is.
Those other symptoms can give you clues about what's causing the effusion.
Exactly.
It's like solving a puzzle, right?
It is.
Each piece of information helps you get closer to the answer.
Yeah.
Now let's talk about another pleural disorder that can be pretty scary. Pneumothorax.
Okay.
What is pneumothorax?
Pneumothorax, sometimes called a collapsed lung,
Yeah, I've heard that.
happens when air leaks into the pleural space, that space between the lung and the chest wall.
Right.
This air puts pressure on the lung,
Okay.
causing it to collapse either partially or completely.
Oh, wow.
And there are different types of pneumothorax, each with its own causes.
So instead of fluid in the pleural space, it's air. That sounds pretty frightening. What are the different types of pneumothorax and what causes them? One type is spontaneous pneumothorax, which just happens without any obvious reason.
Really?
Yeah. Then there's primary spontaneous pneumothorax,
Okay.
which typically affects young, healthy people, especially smokers.
Interesting.
It's thought to be caused by tiny air sacs on the surface of the lung called blebs rupturing.
So these blebs are like weak spots that can break open, letting air leak into the pleural space.
Exactly. It's like a tiny hole in a balloon.
What about secondary spontaneous pneumothorax? Who gets that?
Secondary spontaneous pneumothorax usually happens in people who already have some kind of lung disease.
Okay, so people with things like COPD or cystic fibrosis.
Right. That damaged lung tissue is more likely to rupture, leading to a pneumothorax.
So it's more serious if you already have lung problems.
It can be. It's harder for the lung to re-expand when there's underlying damage.
What about the types of pneumothorax that aren't spontaneous? What causes those?
Traumatic pneumothorax, that's caused by an injury to the chest.
Right, like from an accident or something.
Exactly. Things like a car accident, a stabbing, or even a broken rib.
Okay.
The injury lets air from outside the body get into the pleural space.
And then there's tension pneumothorax, right? That one sounds really serious.
Tension pneumothorax is definitely the most serious type.
Yeah.
It can be life-threatening.
What makes it so dangerous?
It happens when air gets trapped in the pleural space and can't escape,
Okay.
creating a one-way valve.
So air keeps going in,
Exactly.
but it can't get out.
Right. And with each breath, more air gets trapped, increasing the pressure.
Oh, wow.
This compresses the lung and even the heart and major blood vessels.
That sounds terrifying.
Ah.
So it's not just a collapsed lung, it's this pressure buildup that affects your whole chest.
It is. It's a medical emergency that needs immediate attention.
What are the signs of a tension pneumothorax and how do you treat it?
Some of the signs are severe shortness of breath, chest pain.
Okay.
The trachea, that's the windpipe, might deviate to one side, and you might not hear any breath sounds on the affected side.
So what do you do?
You need to relieve the pressure quickly.
How do you do that?
They'll insert a needle or a chest tube into the pleural space to let the air out.
Wow. So every second counts with tension pneumothorax.
Definitely.
It's good to know the warning signs.
It is.
Now, let's move on to mediastinal disorders.
Okay.
What exactly is the mediastinum?
The mediastinum is the area in the center of your chest that separates your lungs.
Okay.
It contains your heart, major blood vessels, esophagus, trachea, lymph nodes, and other important structures. It's like the central hub of your chest.
So lots of vital organs all packed into one space.
Uh-huh.
What kind of disorders can affect the mediastinum and what makes them so difficult to deal with?
The mediastinum can be affected by a wide range of things.
Like what?
Masses and tumors.
Okay.
Infections.
Right.
Inflammation.
Gotcha.
What makes these disorders so challenging is that everything's so close together in there. Any problem in the mediastinum can potentially press on or disrupt those vital structures,
Right.
leading to all sorts of problems.
So even small abnormalities can have big consequences.
Yeah.
Let's start with mediastinal masses.
Okay.
What are the most common types and how do they usually present?
Mediastinal masses can develop from any of the structures in the mediastinum,
Okay.
and they can be benign
Yeah.
or malignant.
Right. Cancerous or non-cancerous?
Exactly.
What are some examples?
Some of the most common ones are thymomas.
Okay.
Those come from the thymus gland.
Right.
Then there's lymphomas,
Yeah.
which start in the lymph nodes,
Uh-huh.
and germ cell tumors,
Okay.
which can have different types of tissues in them.
So the symptoms of a mediastinal mass can vary a lot,
They-
depending on where it is, how big it is, and if it's pressing on anything else.
Exactly.
How do they diagnose and treat these masses?
Diagnosing a mediastinal mass often involves imaging studies,
Okay.
things like chest x-rays and CT scans,
Uh-huh.
and a biopsy to see exactly what kind of mass it is
Yeah.
and whether it's benign or malignant.
Sure.
Treatment really depends on what type of mass it is,
Okay.
how big it is, where it is,
Really?
and the patient's overall health.
Makes sense.
Surgery is often the best way to remove a mediastinal mass,
Right.
especially if it's causing symptoms
Uh-huh.
or if there's a concern that it might be cancerous.
What if you can't do surgery?
There are other options too, like radiation therapy
Well,
and chemotherapy,
right.
depending on the type of mass.
It sounds like a complicated decision.
It can be.
You have to carefully weigh the risks and benefits of each option.
Exactly.
Now, you mentioned mediastinal infections.
Right.
Tell me more about those. How do they differ from mediastinal masses?
So mediastinal infections are called mediastinitis,
Okay.
and they're serious conditions that involve inflammation of the tissues in the mediastinum.
Right.
They can be caused by a few different things.
Like what?
An esophageal perforation, which is a tear in the esophagus. Infections spreading from nearby structures like the lungs or the heart,
Uh-huh.
or complications from chest surgery.
So unlike mediastinal masses,
Yeah.
which tend to grow slowly,
Right.
mediastinal infections can develop quickly,
Yes, they can.
causing all sorts of serious symptoms.
Exactly.
So it's a rapid attack on those vital organs in the chest.
Mm-hmm.
What are the typical symptoms of mediastinitis, and how is it treated?
People with mediastinitis usually have severe chest pain, fever, chills,
Okay.
shortness of breath, and a
Right.
rapid heart rate.
So how do you treat it?
Treatment involves prompt surgical exploration
Okay.
to drain any infected fluid,
Uh-huh.
and then they'll give intravenous antibiotics.
You go in and clean it out,
Yeah,
try to kill the infection.
exactly.
But it can still be life-threatening.
It can, because the infection can spread so quickly,
Right.
and there's always the risk of complications.
It sounds like a real race against time. Now let's talk about another condition that can affect the mediastinum, pneumomediastinum. What is that, and how does it differ from the other conditions we've discussed?
Pneumomediastinum is when air leaks into the mediastinum.
Okay.
Usually this happens because of a rupture in the airways or the esophagus.
Ah, interesting.
It can also happen when air gets into the mediastinum from the neck or the abdomen.
So unlike mediastinal masses or infections,
Right.
which usually cause compression or inflammation,
Exactly.
pneumomediastinum often causes this crackling sensation in the chest and neck.
Huh.
So it's not a mass or an infection, but air getting into a place it shouldn't be.
Exactly.
What causes those ruptures that let air leak into the mediastinum?
Trauma, like a blunt force injury to the chest.
Right, like from a car accident or something.
Yeah, that's a common cause. But it can also happen spontaneously,
Right.
often from forceful coughing or vomiting,
Wow.
which can create enough pressure to rupture those little air sacs in the lungs. Some medical procedures can also accidentally cause it,
Like what?
things like bronchoscopy or endoscopy.
So there are many ways air can get into the mediastinum. What are the signs of pneumomediastinum and how do you treat it?
The most common symptom is chest pain,
Okay.
which can be sharp,
Right.
often worse when you breathe deeply or swallow.
Easy.
You might also hear a crackling sound called Hammond's sign when you listen to the heart with a stethoscope.
Huh.
Luckily, most cases of pneumomediastinum are mild, and they go away on their own with conservative treatment.
Like what?
Things like pain relief and supplemental oxygen.
So you just help manage the symptoms and let it resolve on its own?
In most cases, yes, but in more severe cases where the air is putting too much pressure on vital structures,
Yeah.
they might have to do a needle aspiration or even surgery to relieve the pressure.
So most cases are fine on their own, but you have to watch out for those complications. We've covered a lot of ground here. Pleural effusions, mediastinal masses, pneumomediastinum. It's been fascinating learning about the chest cavity and all the things that can go wrong there.
It has been a lot of information.
Now we're going to get into some of the most serious lung conditions, including acute respiratory distress syndrome and lung cancer.
Those are definitely the big ones. Welcome back to our deep dive into lung health. We've been through a lot, from those infections to the problems with damaged airways. But now we're going to talk about some really serious conditions where lung function is severely affected. We're going to explore acute respiratory distress syndrome and lung cancer.
These are the ones that often make the news and worry people. Let's start with ARDS. What exactly is it and what makes it so dangerous?
Imagine your lungs, which are responsible for getting oxygen into your body, suddenly becoming overwhelmed with inflammation and fluid. That's basically what happens in ARDS. It's a really serious condition with severe shortness of breath, low blood oxygen levels, and widespread inflammation in the lungs.
So it's like the lungs are drowning.
In a way, yes.
What causes this to happen? Is it always a direct injury to the lungs?
Not always. That's one of the things that makes ARDS so complex. It can be caused by a direct injury, like a bad pneumonia, inhaling something toxic, or aspirating stomach contents into the lungs. But it can also be caused by something happening somewhere else in the body that then affects the lungs.
So the lungs are kind of collateral damage.
You could say that.
What are some examples of things that can indirectly lead to ARDS?
Things like sepsis, which is a widespread infection,
Mhm.
severe trauma, like a bad car accident, or pancreatitis, which is a serious inflammation of the pancreas.
Okay.
These conditions can release a lot of inflammatory molecules into the bloodstream, and those molecules can damage the lungs.
So whether it's a direct attack or an indirect one, the lungs are in trouble. How does ARDS actually develop?
It's complicated, but basically, the initial injury triggers a huge inflammatory response in the lungs. This inflammation causes fluid to leak from the blood vessels into the tiny air sacs, making it hard for oxygen to get into the bloodstream. And the air sacs start to collapse, making it even harder to breathe.
It sounds terrifying. The presentation mentioned 3 phases of ARDS: exudative, proliferative, and fibrotic. Can you explain those?
The exudative phase is the first phase, usually lasting about a week. That's when that intense inflammation happens, causing the fluid leakage and the formation of these things called hyaline membranes, which are basically protein deposits that make the air sacs stiff.
So the air sacs can't work as well.
Exactly. They can't exchange gases effectively. Then comes the proliferative phase, usually between days 7 and 21. The body tries to repair the damage during this phase.
Okay.
But it doesn't always go smoothly. You get these fibroblasts, which produce collagen, and that leads to scarring and thickening of the lung tissue.
So it's like the body's trying to fix things,
It is.
but it's making it worse in the process.
Yeah. Kind of, yeah. And then the final phase is the fibrotic phase. This is the late stage, where you get a lot of fibrosis or scarring, which can cause permanent lung damage. The lungs become stiff, and it's really hard to breathe.
So it's this progression from inflammation and fluid to scarring and stiffness. How do you diagnose ARDS, and what are the treatments?
Diagnosing ARDS involves looking at the clinical findings, doing imaging studies, and analyzing blood gases. Doctors look for specific things, like a low ratio of arterial oxygen tension to the fraction of inspired oxygen, or PaO2 if IO2. That basically tells you how well the lungs are getting oxygen into the blood. They also look for these things called bilateral infiltrates on chest x-rays, which show that the lungs are widely affected.
So you're looking for signs of widespread inflammation and problems with oxygen getting into the blood. What about treatment?
Treatment for ARDS is mostly about supporting the patient, keeping their oxygen levels up, managing fluids, and supporting other organs that might be affected. They often need mechanical ventilation to help them breathe.
So the focus is on keeping them alive while their body tries to heal.
What are the chances of survival with ARDS?
Unfortunately, ARDS has a high mortality rate, often over 40%. It depends on how bad the lung injury is, what caused it, and the patient's overall health. Even if someone survives ARDS, they can have long-term lung damage and might need help breathing for a long time.
It's really scary how fragile our lungs are. Now let's talk about lung cancer. It's the leading cause of cancer deaths, isn't it?
Yes, unfortunately. Lung cancer is a very serious disease that kills millions of people every year. Most cases are caused by smoking, but there are other risk factors too, like exposure to radon, asbestos, and air pollution.
So it's mostly related to lifestyle choices, but not always. What are the different types of lung cancer and what makes them different?
There are 2 main types: small cell lung cancer and non-small cell lung cancer. Non-small cell lung cancer is much more common, about 85% of cases.
Okay.
It has a few subtypes, including adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Small cell lung cancer is less common, but grows and spreads much faster. So different types, different behaviors. What are the signs of lung cancer? What should people be looking out for?
Lung cancer can be tricky because there are often no symptoms until it's already spread. That's why early detection is so important. The most common symptom is a cough that doesn't go away, and there might be blood in the sputum. Other symptoms include chest pain, shortness of breath, wheezing, hoarseness, fatigue, and losing weight without trying.
A lot of those sound like the other lung conditions we've talked about.
They do, which is why it's important to see a doctor if you have any concerns.
How do they diagnose lung cancer, and how do they decide on the best treatment?
To diagnose it, they usually do imaging studies like chest x-rays and CT scans, and then a biopsy to check for cancer cells.
Okay.
Staging the cancer means figuring out how far it has spread.
All right.
That helps them decide on the best treatment.
What are the treatment options?
The treatment depends on the type and stage of the cancer, as well as the patient's health and preferences. They might do surgery to remove the tumor, radiation therapy to kill the cancer cells, chemotherapy to destroy cancer cells throughout the body, or targeted therapies that specifically attack the cancer cells. Sometimes they use a combination of these treatments. There's also immunotherapy, which helps the body's own immune system fight the cancer. That's showing a lot of promise.
It sounds like there are a lot of options, which is good. The presentation also talked about solitary pulmonary nodules. What are those, and should people be worried about them?
A solitary pulmonary nodule, or SPN, is just a small, round growth they find in the lung on an X-ray or CT scan.
Okay,
Most of the time, SPNs are benign, which means they're not cancer.
that's good.
They can be caused by infections, inflammation, or even scar tissue.
Right.
But some SPNs can be malignant, meaning they are cancerous.
So it's like finding a lump in your lung. How do you know if it's something to be concerned about?
It's not always easy. Doctors consider a few things to figure out the risk, like the patient's age, whether they smoke, the size and shape of the nodule, and if it's changing over time. They might also use special imaging techniques, like PET scans, to get a better look and see how active the nodule is. If it looks suspicious, they'll usually do a biopsy to be sure.
So it's a process of assessing the risk, keeping an eye on it, and if needed, doing a biopsy to figure out what it is. We've covered so much in this deep dive into pulmonary conditions. We've learned about asthma, COPD, pneumonia, and even lung cancer.
It's been a really comprehensive look at lung health.
It really has. We've learned about how the respiratory system works and how important it is to catch these conditions early, treat them promptly, and manage them properly. So, to wrap things up, I want to leave our listeners with something to think about. Knowing what you now know about how important lung health is, how common these conditions are, what can you do to protect your lungs and breathe easier? Quit smoking if you smoke, avoid secondhand smoke, pay attention to the air quality, and just take some deep breaths and appreciate your lungs. Thanks for joining us on this deep dive into the world of pulmonology.
Thanks for having me. It's been a pleasure.